Hello, everyone. This is Brian with KWB Pathology Associates. I'm the Client Service Director, and joining me on this call is Dr. Aaron Carlquist, one of our dermatopathologists and our medical director. And we want to thank the Emerald Coast Medical Association for the opportunity to put this together for you and tell you a little bit about some new things we have going on in our lab. So I'm going to try to share my screen now and share with you guys a little bit about what we have going on at KWB that we hope will help you guys out. So, what we have going now at KWB is some new technology that we're bringing in for women's health testing and STI testing. And we brought in a new testing modality called the Panther, which is made by Hologic. And this elevates our STI testing technology to be able to bring more to the market from our lab. And the addition of the Panther will allow us to accept the commonly used Aptima swabs, which probably all of you that do women's health testing have those in your office. It's the orange tubes with the swabs that you guys use pretty regularly. And it helps expand our test menu where we can offer more testing, and we'll get into a little more detail on that in a moment. And we'll talk a little bit about why we made the switch to the mRNA-based test with the Panther. And then lastly, we're going to share an educational video by our friends at Hologic entitled Breaking the STI Cycle with Accurate Mycoplasma Genitalium Testing. And it's about a 30-minute long video, but I think it'll be very informative. MGen, as it's known in short, Mycoplasma Genitalium is emerging more and more out there. And, it's one of those, I guess you could say, Dr. Carlquist, if you can't figure out what other STI the person has, this is kind of becoming the thing that a lot of people are finding out there.
Yep. And now it's becoming easier and easier to diagnose and then be able to treat with technology like we have now. So that's exciting.
Yes. So this is what the Panther looks like. It doesn't have that cool graphic on the front, but that's the Panther machine. And it's a fully automated molecular diagnostic testing platform made by Hologic. I won't go into all the details on here, but it's a great new piece of equipment that we have. It's not a new technology. It's been used in other places, for a couple of years or so, but we're now adding it to our lab and replacing the old technology that we used previously. And what this will allow us to do now is, like I said, we'll be able to accept Aptima swabs, which are like the little orange swab you see down here. Like I said, most all of you probably already use the Aptima swab and already have it. So that's great. So previously we could already test for with ThinPreps, and our previous equipment we could test for HPV, chlamydia, gonorrhea, trichomonas, and we could test for Mycoplasma genitalium before as well. With the addition of the Panther, we can also add on tests for the HSV virus, 1 and 2, bacterial vaginosis panel, Candida glabrata, that's easy for me to say, Candida species, and very soon we'll also be able to add group B strep. So for those of you that test for those things, we will now be able to accept those things in our lab. And these are covered on pretty much all the insurances you guys see and all the insurances we already accepted. The only exception would be, and I don't think this affects too many of the Emerald Coast Medical Association members, but maybe a few Capital Health Plan. Right at the moment, they won't cover these new tests just yet. but we're hoping they will very soon. So, so just want to, be upfront about that. And if you have any questions about what insurances we accept, there's a full list available on our website, kwbpathology.com. You can check that out anytime. And on the right side of this page, you can see what tests you can order with which different type of tests that you do. So for instance, with the ThinPrep PAPs, you can test for HPV, chlamydia, gonorrhea, and trichomonas. With the urine testing, we can do chlamydia, gonorrhea, trichomonas, and mycoplasma genitalium. And then with the Aptima swab, you can test for chlamydia, gonorrhea, trichomonas, mycoplasma genitalium, bacterial vaginosis, the Candida glabrata, the Candida species, and the HSV 1 and 2. The caveat with the HSV 1 and 2 is that must be a separate swab from an active lesion. And I don't know if you can add anything to that, Dr. Carlquist, as far as the reasoning behind that needs to be a separate swab.
Yeah, well, usually we're doing these swabs, obviously, from like the cervical os, and when you're doing a PAP. And so usually the HSV 1 or 2 is going to be an active lesion, usually more on the external surface, on the labia or something like that. And so it's kind of probably going to be affecting a different site. And so you can catch everything else in the cervix, but then really, unless you have an active lesion involving the cervix, you've got to go for wherever that active lesion is with a separate swab to be able to get that.
So now this is a little graphic shared by our friends at Hologic on the reason why we feel like the mRNA test is better than the previous modality we used, which was a DNA-based test. So I don't know, Dr. Carlquist, if you can just touch on that just a little bit.
Yeah, sure. So I think the biggest thing, there's a couple of things on this page here with improved specificity, especially. But in addition, I think the more interesting thing to me is that, and more convincing that this is really a good option to use versus the DNA, is that at the very bottom here, it tells you that the mRNA levels, as your dysplasia progresses from low grade to high grade, and it's getting, progressively worse disease, that the RNA levels are actually rising. And so you're going to get less false negative results than you would with the DNA. So I think that that's actually really convincing and something that that is a very positive for this new test. So yeah.
All right. And if any of you guys need more information, we didn't want to go too in depth or into the weeds with this today. But if any of you guys have any questions, you can always feel free to reach out to me, either via my phone line, which is 850-219-7608, or you can email clientservices@kwbpathology.com and ask me any questions. And as I mentioned earlier, our website is a great resource as well. If you need any information, you can print requisitions from there. You can find what insurances we accept. You can find phone numbers directly to any of our departments you need to get in touch with. So definitely use our website as a resource to get whatever information you need or get in touch with who you need to get in touch with. And Dr. Carlquist and all of our pathologists are always willing to talk to you guys anytime you need help or have a question. You can call our main line, 850-878-5143, and ask for Dr. Carlquist, and she would be more than happy to talk to you. I can share an example, and I won't single the person out, but there was a Emerald Coast Medical Association doctor over in Panama City reached out to me recently about a biopsy that he had taken, and wanted to talk to one of the pathologists, and asked if the pathologist would call him when they read the case. And I gave the pathologist his number, and he called him, and they had a great conversation about it. And that's the kind of collaboration we like to be able to do with you all, and be able to give you guys those answers when you need them. So definitely feel free to reach out to us. And that's not something you can get with everyone out there, especially the big labs. So that's something that we offer, we think is unique. So any other comment you have on that, Dr. Carlquist?
Yeah, no, thank you, Brian, for putting this presentation together. And we're very excited to be able to offer this new technology. I think that what we had before was great, but this gives us so many more options to serve your patients. And in addition, it's going to be the same options for testing with the same technology that you might get somewhere else, but you're going to get a lot faster turnaround time. And I think that that's better for everybody. It's better for our clinicians, and it's better especially for our patients. So that's really what we're wanting to offer here, is widening our test menu with better technology, and also giving you the results faster, because that's really important for patients, and so that they can start getting treated. In addition, I think it's interesting, the video that we're going to watch in a minute, mycoplasma genitalium was not really something that was so commonly put into that STI category back, years ago, and it's becoming more widely understood and identified, mostly because we now have the testing available to us where we can identify mycoplasma genitalium. So I think this video has really interesting information, and I hope you enjoy that. And I'm also very excited that we're going to be able to test for HSV and bacterial vaginosis panel, different Candida species, and soon Group B strep, which is very exciting for us. So I hope we're able to really serve your patients better. And like Brian was saying, we very much enjoy being able to talk to our clinicians and develop relationships with you guys and get to know you, even if it's just over the phone and at a meeting, maybe just once a year. But we would love for you to reach out if you have any questions about this testing, how to send the test. It really should be so simple, since, as far as if you're testing for HPV, chlamydia, gonorrhea, and trick off of the PAP, that's all the same. And pretty much everyone's got the Optima swab in the office already. So all you've got to do is when doing the PAP, do an Optima swab, and send it to us. So it should be pretty straightforward, but we're trying to make it as easy as possible for everybody. But if you have any questions, please don't hesitate to reach out. I am, like Brian said, a pathologist, dermatopathologist, and I'm also the medical director of our lab. So if there are any issues or concerns or questions that you have, please don't hesitate to reach out to me. I would love to help. And Brian is always there as well. That's all I have. Thank you so much for joining us.
All right, thank you guys, and I'm going to share this video in just a moment. But again, thank you to the Emerald Coast Medical Association, Michelle, Dr. Davis, and everyone at the Emerald Coast Medical Association. We appreciate the opportunity to work with you all, and please reach out to us whenever you need anything. All right.